A lot of us have been thinking about osteoarthritis incorrectly for a long time. Historically, and even today, most people and even doctors will consider osteoarthritis to be some type of combination of the effects that happen to a joint through age and a combination of wear and tear. So, the conventional thinking of osteoarthritis associates aging and some combination of overuse with the destruction of some of the cartilage that sits between our joints, causing the space between the joints to become thinner and the presence of these osteophytes to start to show up. And then it also leads to this lumpy, bumpy type of appearance, which is kind of the hallmark of osteoarthritis. And then we have to differentiate osteoarthritis, which is where pain in the joints happens associated with that wear and tear mechanism, with rheumatoid arthritis, which is a different disease process in which inflammation creates widespread destruction of the joints. But scientists have been studying this for a while, and most of the conclusions associate the osteoarthritis as kind of an inflammatory disease instead of this wear and tear problem. Current thinking suggests that rheumatoid arthritis is a specific autoimmune process prone to flare-ups of very acute and intense inflammation, while osteoarthritis is more likely due to this persistent chronic low-grade inflammation. So this is a picture of a knee joint, and the joint is actually surrounded by something called a joint capsule, and inside of the joint capsule is something called synovial fluid. And in 90% of patients with osteoarthritis, they've actually identified elevated levels of synovial inflammation inside of the joint. So inside of our joints, you have this synovial fluid, and inside the synovial fluid, there are these inflammatory proteins released by our macrophages and other immune cells that can be quite disruptive to how chondrocytes, which produce cartilage, are working, but also to our bone-producing and bone breakdown cells called osteoblasts and osteoclasts. There's also evidence that there are genetic factors at play because when we look at patients with osteoarthritis, there's increased expression of microRNAs that actually produce more inflammatory peptides that are probably contributing towards the breakdown process. This becomes really important as healthcare providers because if we are teaching people that osteoarthritis is related to aging and wear and tear, then our recommendations are going to be a lot different for people. Because if it's a wear and tear problem, that's going to change our recommendations. Like we might discourage someone from running, even though some of the best evidence suggests that running is actually protective against osteoarthritis in the knee, where the previous thought would have suggested that running would be negative for it. And we actually have some similar studies in the spine where running is actually protective of the intervertebral disc, whereas it used to be thought that running was actually going to make disc problems worse. And instead, we should be focusing on things that can contribute to inflammation, like an acute injury can cause inflammation that damages joints. Metabolic syndrome is a really modifiable risk factor that can affect our joints. Aging, we might not be able to affect quite as much. And even things like crystal deposition can be affected by things like diet. So instead of discouraging physical activity, we should be encouraging physical activity to reduce our chances of metabolic syndrome-induced osteoarthritis.